So you're interested in becoming an LCSW. Well, you are in luck because I am an LCSW supervisor and I'm going to share some of the brief highlights about what an LCSW is and why you should pursue it, how to get started with finding a job that will get you the right hours that you need, and connecting with an LCSW supervisor. Exactly what those details are on the hour and supervision requirements, different types of supervision, exam information, and how to continue with your license. Now I'm going to give a disclaimer here. I recorded this video in January of 2022, so if you are from the future watching this video, please keep in mind that regulations and policies and forms are changing all the time. This is not an official product of the board or of NASW or ASWB or any of those folks. This is my understanding of the Occupations Code, TAC, and the BHEC rules, and this is Texas specific. So there are different licensing requirements for clinical social workers in various states. This applies specifically to the state of Texas. And I will say always contact or check in the website with BHEC to verify information and check for updates. And for clinical social workers, certainly consulting with your clinical supervisor. They should be the expert who's up to date on what's happening as you're going through it. But I hope that this video provides a basic overview of the process to give you an idea as you start your journey. Again, here are the references, the Texas Administrative Code and the Consolidated Rulebook for Social Work, where a lot of this information is pulled from, which I'll be citing, but is always changing too. So what is an LCSW? I have these images here because social workers are the best and everyone else is sad that they're not us. I say that mostly in jest. I have immense respect for my colleagues representing other branches of mental health work, and all of these different professionals have some similarities in their goals and in the way that they positively impact people in the community. And so no disrespect, but I will give a very brief, simplified synopsis of my understanding of why social workers are so cool, which is just that social work is broad and allows you to do so many amazing things. So like LMFT, which is Licensed Marriage and Family Therapist, and LPC, Licensed Professional Counselor, social work typically are practitioners with a master's degree, sometimes just a bachelor's degree, but they can do a lot of the things that some of these other folks can do regarding assessment, diagnosis, and treatment of mental health issues, clinical work, meaning mental health and related clinical processes. But we can do a lot of other really cool things too. There's so many different settings and populations and social issues that we work with. We work on a micro level, on a macro level, but the way to pursue the specific realm of clinical mental health work is through an LCSW. Psychologists are trained at the doctoral level and tend to, I've found, have a lot of great expertise in assessment and diagnosis. Psychiatrists are medical doctors who can prescribe medications, but clinical social workers are pretty cool. And in terms of the differences between a bachelor's, master's, and clinical level social worker, I'm pulling a lot of this from TAC 781.302 to be exact, and it talks about the practice of social work. And you can read this yourself about the differences, but to simplify things, LBSW is more of a generalist practice, whereas a master's level license gives you the ability to apply more specialized knowledge and advanced practice skills. And then clinical is more, therapeutic. So you're applying those special skills and clinical knowledge in assessment, diagnosis, and treatment of mental, emotional, and behavioral disorders. So why should you pursue your LCSW? It's probably been a lot of work getting to even the other levels of social work licensure. It is the highest level that you can go, so it's really the pinnacle in terms of licensing of what you can do in the social work career field. There is the potential to qualify for more job opportunities and higher earnings potential. Of course, this really depends on the place that you are and a lot of different factors, but it opens more doors, I will say, to more and sometimes better opportunities. It also gives you way more options regarding private practice. So if you want to do your own private practice, being able to bill, like Medicare or insurance, bill insurance for services, you have to have that C, that clinical designation. And it's just really cool. I'm a nerd, but I think it's so fun to learn about the different things that you learn about as you pursue your clinical licensure. And it's really fascinating and applicable both to your career and to your personal life, in addition to your professional life. So I sold you, right, on getting it. How do you get started? Well, you have to have completed your MSW, Master of Social Work degree from a Council in Social Work Education accredited university, or have a doctoral degree in social work. And you have to have your LMSW. So you have to have already been licensed at the LMSW level to start this process. And keeping in mind that if you're recently out of school, your field placement hours do not count towards clinical licensing. So those field placement hours that you have in school go towards your degree, but the clock starts over once you graduate. You have to find a place where you are working 30 hours a week on average. I'll say more about that, but at least 4 of those need to be with elements of the clinical process. I'm going to have a little caveat here. I'd always heard that it was the 3 magic words: assessment, diagnosis, and treatment. Assessment, diagnosis, and treatment. I've heard other folks saying, that having all of these elements of the clinical process is great. So and I'll talk again about this in a bit more detail, but the terminology that the board has right now in the clinical supervision is assessment, diagnosis, treatment. But I think it's great if you can have all those elements to give yourself more experience and make sure that there's no issues in terms of approving that job description to work for your clinical work. So some examples of this might be working in an inpatient facility or things like that. So I'll talk more about hours, but also as you get started, you have to arrange for supervision with an LCSW-S. This is not just any LCSW that you pluck off the street. This is someone who's completed at the time of this recording, a 40-hour training in supervision skills and different things like that, and has a special S designation by the board. You might be fortunate to have a LCSW supervisor through your workplace who supervises you anyway as part of your job. You can also get outside supervision through networking or referrals or checking. There's a list on the BHEC, that's our board website. Not super up to date, but those are some places to get started. So you've got a good job that's going to give you that kind of, experience and hours that you need. Got your awesome supervisor lined up. Now you have to put in place a clinical supervision plan for an LCSW. It really outlines exactly what's a part of that plan, and you can go see it yourself, and your supervisor can guide you through exactly what's expected at the time that you start. Over the course of 24 to 48 months, that means that even if you are Superman or woman and you just are working 100 hours a week and getting supervision out the wazoo, you cannot finish any sooner than 24 months. It's a minimum of 24-month period that you can be working on these things, and a maximum of 48 months. So between 2 and 4 years, you will get the hours and supervision that you need in order to qualify to then sit for the clinical exam and get your clinical license. Let's talk more about the hours. Again, this is during that 24 to 48 month period. You need to accrue 3,000 hours of board-approved supervised professional social work hours. That can be pretty broadly defined. I'm just going to say it's anything social worky. If you have a social worky job, you're probably good. It works out to be about 30 hours a week, 50 weeks a year, factoring in a couple weeks of vacation for 2 years. Again, you can take a bit longer, up to 48 months, but you can't do it any sooner than that. But of those roughly 30 hours a week that you're going to be doing, 4 of those hours every week need to have, again, I mentioned this, the elements of the clinical process, certainly assessment, diagnosis, and treatment, or intervention is another word for that, but To be safe, I think assessment, diagnosis, treatment planning, intervention, and discharge and referral. Now, in terms of how you get this, there's some different information. So you might just have all this at your place of work, in which case it's really easy and straightforward. If you go the route, which I did, which is where somebody is maybe working their main job and then also getting those clinical hours on the side, at least 4 hours a week, and patching together 2 different jobs or experiences, I'll just say you should work with your supervisor to talk about what's involved in that process. As I'm recording this, there are a lot of discussions about the rules regarding independent contracting for LMSWs. The short answer is that an LMSW can't just hang their shingle out and do private practice, but there have traditionally been some methods where they've worked either as independent contractors or part-time workers, or even volunteering pro bono, where they're not billing, but maybe receiving cash or pro bono clients. But there's going to be more clarification to that coming, so be on the lookout for that if that applies to you. Okay, so let me read to you the exact wording that's on the clinical supervision form regarding these magic words. Is that at least one practice location must provide the supervisee a minimum of 4 hours per week of direct clinical practice, gaining competency using specialized clinical knowledge and advanced skills to assess, diagnose, and treat mental, emotional, and behavioral disorders, conditions, and addictions. You're also going to get supervision, and that is going to total at least 100 hours. Both of these you can go over, but this is the minimum. So 100 hours of supervision works out to 1 hour of supervision per 40 hours worked. You need to have supervision at least twice per month, no less than 4 hours per month, and no more than 10 hours per month. And your supervisor will be able to help provide a schedule on what that looks like. In terms of types of supervision, I mentioned you might be able to get one through your employer, which is free, so yay for you. And one advantage there is that they're going to be more connected to your agency policies. They might have much more familiarity with the client cases. But free is not necessarily always the best, and some people might not have access to an LCSW-S through their workplace. So then you can pay for outside supervision. You're going to need to get an agreement from your main employer on letterhead, and you can share client data and things like that. There's instructions about this in the supervision plan about what exactly must be submitted if you're going for outside supervision, but that is an option. Within supervision, there's also a few different types, namely group versus individual supervision. As you can imagine, one of the main benefits of individual supervision is that you get a lot of specialized individual attention. There's more time for discussion, feedback. Your supervisor is going to get to know you better and help, keep you accountable, checking in with different things. So it's really going to give you that individualized attention and focus on you, which could be really helpful. I did supervision in a group, and I think group supervision is really great. There are a lot of benefits to group supervision. Networking. I'm still friends or connected with people that I did group supervision with, and because we were all seeing an outside supervisor, all of us worked in totally different settings, with long-term care and schools and refugees and all sorts of different, IDD, and getting to hear about the experiences of people in these variety of settings helped expand my knowledge of social work practice, but also helped me connect with a lot of different individuals in practicing in the community. You can also have social learning. So you hear more scenarios, you get input and perspectives from your peers. It's often less expensive because if a supervisor is able to have between 2 and 6 people at a time, they're going to charge less than if they're having to do one at a time. You also might have to deal with some of those group dynamics. We all know that working in a group is not always easy, and not everyone clicks with each other. And so there can be some of those dynamics to navigate, and the potential for comparing where you are with someone else in your group who might be at a different process in their supervision. But overall, I think group work can be a really beneficial part of the process. There is also a potential for online supervision. This is allowed, and it can be, of course, very convenient and help you connect with folks even outside of your geographic area. Just like anything regarding telehealth, you want to make sure that you're considering privacy and confidentiality issues, and be all kind of within the state of Texas and that kind of thing. What should you expect in supervision? I interview my supervisees before we start in supervision, and I encourage you to do the same. Decide if it's going to be a good fit and if they're going to provide, especially if you're paying for it, the value that you're looking for in terms of having that structure and support. You should be getting some education and knowledge about all things clinical, mentorship, guidance, helping to staff cases and give you support and encouragement, giving constructive feedback and evaluation and feedback and more evaluation to help you grow professionally, helping you to prepare for the ASWB clinical exam, and bottom line, just helping you grow to be a more ethical and effective clinical practitioner. When you are done, other than party, some of the things that you need to do are to submit verification of hours. Actually, I think now the supervisee actually submits everything, but this is another one of those things. You got to know your stuff and double check and see what the rules are at the time that you are ready, because things are changing. But there is a verification of hours form that you and your supervisor sign off on. You have to submit an application to upgrade basically from an LMSW to an LCSW, assigned supervision plan, completion of that good old jurisprudence exam, which is just an online tutorial. It's not a big deal. You're not going to fail it. Fingerprints and background checks, depending on what different rules they have, paying a fee, lucky you, and then preparing for and taking the ASWB exam. So again, checking back on the BHEC website, because there have been some changes to the process in terms of whether you apply first and then take the exam or vice versa. So check into that. But ultimately, you will do both things. You will apply to the board and you will take and pass and rock your ASWB exam. Just like the LMSW, which you will have taken by the time you're doing this, it is a computer-based multiple choice exam with 4 hours to complete. There's 170 questions, with only 150 of those being real counted questions and 20 that are being tested for validity, but you'll never know which 20. And I always say, if you come across a real tough question that is stumping you, you can just tell yourself, I bet this is one of those 20 that they're testing, and it's not a very good question because it's very confusing, right? And your passing score depends on which version of the test that you get, somewhere usually in the range of between a 93 to 107, depending on which version of the test you get and how easy or difficult your questions are rated. It's a lot of similar questions to the other 2 levels of licensing. So there's elements of the human development, HBSE theories, diversity, assessment, interventions, and ethics. And as you can see, they're sort of weighted in different ways. So you can prepare similarly as you have for other exams, but with a focus on obviously more clinical stuff like assessment and intervention. You'll know right away whether or not you failed the exam. There is no maximum limit on the number of exams you can take. I've heard some folks say that you can do it 3 times, and then after that you have to get board approval to do it after that. I'm not sure what's happening now, but there's also sometimes a waiting period, like 90 days between exams. For LCSW specifically, you do have a clock to go against, though. From the time that you first apply, like finish your supervision and are ready to take the exam, you have 5 years to get it done. So hopefully you'll be able to fly through it much faster than that. And there is no alternative. If you have been around for a while and you'd heard of AMEC, the alternative method of examining competency, that is not an option anymore. You have to pass the test, and there is no other way through. Once you earn your clinical license, you want to maintain it, right? You have to do 30 hours, just like you do with your master's license. 6 of those have to be in ethics. You need a human trafficking credit. You can carry over 10 credits. This is a fairly new development. In terms of things that count as a CEU, there's rules that are listed out in TAC as far as what exactly counts as a CEU. Some things that you'll notice is that they always have an evaluation. They always have like a certificate. So you can't just watch an informative video online and say that you took a CEU. It's more formalized than that. And there's also some other ways. People aren't always aware that there's a lot of different ways you can get CEUs besides just going to a CEU training, like taking graduate level classes, teaching classes, being a field supervisor, field instructor, presenting a CEU, or doing published research. And again, by the time you're doing this, you'll have already gone through a couple years of your LMSW shenanigans, but keeping in mind that the renewal matches with your birth month. So the last day of the month of your birth. So for me, March 31st, because that's the last day in March, is when my license expires every 2 years. So it's easy to remember in subsequent years, but your very first couple years, the actual amount of time until your renewal could be less than 2 years. And this just kind of shows some examples of what that might look like in terms of when you got licensed. If you have any questions or suggestions or are interested in supervision, you're more than welcome to reach out to me, kmagrudercounseling@gmail.com. And I look forward to hopefully having you as a wonderful clinical social work comrade and colleague in the future.